Hello, welcome to Acharya Nidana Academy. Dear ANM members, wish all you the happy Navaratri, the first day of Navaratri festival is being celebrated in India. In this particular video, we are going to discuss some of the common pitfalls or errors that are being usually performed or practiced by the students in the Ayurveda field. As we know, diagnosis involves 5 different steps: history taking, physical examination, careful collection of all the data pertaining to the patient. Fourth step will be the selection of pertinent or relevant data and rejection of irrelevant data. And fifth step will be suggesting the ancillary laboratory investigations or necessary laboratory investigations. Most of the Ayurveda students in the Ayurveda field, they're actually lacking in documenting the case history. Usually that is actually being presided, that is documented in the same way. Initially it will be preliminary data. Later that will be followed by the documenting the chief complaints along with the duration, and later associated complaints along with the duration that will be documented. After that, we are going to take the history of present illness. In the previous video, we have seen what are the points that will be covered or documented in the history of present illness. Onset, duration, if the person is suffering from pain, location, radiation, character of the pain, severity, course of the symptom, aggravating and relieving factors, lastly, the negative history. If the person is not suffering from pain, in that particular situation, onset, duration, severity, course of the symptom, aggravating and relieving factors, then negative history that will be documented. In this particular video, we are going to see some of the common errors that will be performed by students or the learners of Roga Nidana. The major information that is lacking, the point that are lacking, that is all the points mentioned in the history of present illness, they are not inquired with the patient. If inquired also, they are not documented in the case record. When the symptoms started, whether is it sudden one, gradual one, or insidious one, that is not being documented. If it is being documented with the duration, so then the location, some of the cases they will be asked, but radiation, character of pain, they will not be documented there. Severity, to some extent they may be asking, but course of the symptom, that is not being documented. Negative history, that is not being documented. Regarding the details of all these, onset, duration, etc., see the video of history of present illness. Today we are going to have some of the commonest errors they will be performed by the students. This is one example. Patient was apparently normal 10 days back. Then suddenly he developed pain in the epigastric region since 10 days. After that, for this complaint, he visited nearby XYZ hospital, took treatment. did not get any relief. For the same reason, he is visiting to our hospital and get admitted under Dr. ABC. Here, there is no, what do you say, that the details about the onset. It is not possible by looking into that, whether is it sudden or gradual or insidious. Very difficult to notate. Then, as far as the duration, that is being mentioned in the 8 days back, that is being mentioned, but location is also being mentioned regarding the epigastric region, but radiation is not being mentioned, character is not being mentioned, severity is not being mentioned, course of the symptom is unable to identify, aggravating or relieving factors is lacking here, negative history is also lacking here. So if you are taking document in this way, no question of what you say that the getting any accurate diagnosis there. Second example, where we are making the errors, that is, if the person is suffering from hypertension or diabetes mellitus, writing the case history as patient was apparently normal is the common error that may be performed by the students. Instead, the history should begin as known patient of hypertension since n years and diabetes mellitus since n plus 3 years. Suppose if the person is suffering from hypertension since 3 years, it has to be, and diabetes mellitus since 3 plus 3, 6 years, then history should begin. Known patient of hypertension since 3 years and diabetes mellitus since 6 years. So ideally, diabetes mellitus since 6 years and hypertension since 3 years, that will be the method of writing the case history. And further, that will be is presented with pain in the epigastric region since 3 days or since, and which is of the non-radiating pricking type of pain, severe persistent pain, aggravated by consuming spicy substances, getting relieved by antacids, not having the feature of fever, diarrhea, melena, or hematemesis, etc. This in this way, if you are writing this, then moving towards one particular diagnosis will be very easy. And other major errors that are performed by the students, chief complaints are not being written in the chronological order. That is the same reason the history of present illness will not be presented in the chronological order itself. And all the clinical symptoms, they are being mentioned by the person that will not be having onset, duration, location, radiation, character of the pain, severity of the pain, course of the symptom, aggravating and relieving factors, and negative history will not be documented. If the person is not having pain, then documentation of onset, that is sudden, gradual, or insidious, duration in terms of the days, weeks, months, or years, that will not be there. Severity, whether it is mild, moderate, or severe, course of the symptom, whether it is persistent, improving, or worsening, will not be there. Any aggravating, relieving factors will not be there, and negative history will not be documented. And if they are following these, then negative history of the presenting complaints related to the systemic dysfunction will be missing. In that particular situation, what can be done? So this may be the probable way of writing the case history. That is, patient was said to be apparently normal. Patient was said to be healthy since n days. He presented with pain in the epigastric region. Or patient was apparently normal since n days. He presented with pain in the epigastric region. Otherwise, if the person is having the hypertension or diabetes mellitus, the person known patient of hypertension and diabetes mellitus, known patient of diabetes mellitus since 6 years and known hypertensive since 3 years. In that way, he is presented with. That will be the way of writing the case history. And documenting each of the presenting complaint should have the details of onset, duration, severity, course of the symptom, aggravating and relieving factors. Whereas at the end of the history of present illness, you can write the negative history. That is at least one symptom related to one system that should be recorded. So in the sense, if the person is having the cough, absence of cough rules out respiratory disease, absence of bilateral pedal edema rules out cardiovascular disease. So absence of loose stools rules out alimentary canal dysfunction. Absence of dysuria or burning micturition rules out the presence of a urinary system dysfunction, or the joint pain rules out the presence of musculoskeletal dysfunction, or sensory dysfunction, or the sensory symptoms or reduced strength, etc., rules out the diagnosis of neurological diseases. So like that, at least one symptom related to one particular system that should be documented at the end of the history of present illness. In that way, we can be able to document the case history, the history of present illness completely and accurately. So the take-home message from today's discussion is, as far as diagnosis of the disease is concerned, it is actually clinician specific or the physician specific. That's why you have to document the case history in the accurate manner, in the sequential manner. And this is about the nature of the presenting cases. Patient was apparently healthy, or patient was apparently said to be apparently healthy, or patient was apparently normal since n days or weeks or months or years. Or otherwise, if the person is having any specific known disease, for example, known patient hypertensive since 3 years, or known patient with diabetes mellitus since 3 years, or known patient of hypothyroidism since 4 years, or known patient of cerebrovascular accident since 5 years is presented with. In that way, you have to begin the case history. And all the points regarding the onset, duration, as far as if the person is having the pain, location, radiation, and character, that has to be documented. In the absence of that, onset, duration, severity, course of the symptom, aggravating and relieving factors, and negative history should be documented for the accurate diagnosis. Dear ANM members, that's all for today. What are the major key takeaways from today's session? Mention in the comment box below. And what is the one particular topic that you would like to have discussion in the coming days? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.